staff or a member of the Board of Health, we're asking that you disconnect. You can view this on YouTube and Facebook Live. If I don't recognize the number, I may disconnect.
Here with Dr. Deborah Bogan from the Allegheny County Health Department. Actually coming to you a day earlier than we normally do our weekly briefings. There have obviously been a lot of changes and a lot of rulings that Dr. Bogan and her team have had to put out over the last few weeks based on the data that we've seen. It was only 20 days ago that we had 0 positive cases on our days. And obviously for the number of cases in Allegheny County, they have gone up precipitously. We've had 3 days, including today, that have gone over 200. We had weeks in which we didn't have 200 cases, and now we have them in a single day. So that requires, obviously, action to protect health. And Dr. Bogan and her team have done a great job in doing that. And the contact tracers, the testers who've gone out and done the data to look and see where we are, because balancing the economy and people's activities and all of us who want to live our lives in as normal a process as we can, we know that since mid-March that's been very, very difficult due to the pandemic of COVID-19. Again, we went from red to where everything was shut down, to where we went to yellow, to where we went to green. And in the green, a lot of things opened up, and in early June we started to see things in mid-June, and then the test results came out that kind of confirmed where we are in certain areas. And Dr. Bogan will certainly talk about that, and she has been talking about that. We've been talking about that over the last couple of weeks as those things come out. There's orders in place that expire. One order that expires on Thursday, and Dr. Bogan is going to talk about that, and also the other order that was indefinitely to see if there are some things that can be done over the next few days to maybe ease some of that if, and I use the word if, those numbers remain where they are and don't get any worse. And they're as bad as they are, we certainly don't want them to get much worse. We also, as the weather gets hot and the weather gets warm, we know, wearing the mask sometimes can become a challenge. But as you're seeing nationally, the president, our members of both parties, members of both all organizations in the South, the North, the East, and the West are now having mask requirements, which very well may be a national order that will come out at some point. But we're seeing governor after governor, even in states that before this were not pushing masks, are now requiring masks to be worn. And the one thing that we've been talking about is masks, 6 feet, those type of things. But we also understand that there's going to be places, maybe workplaces that don't have air conditioning and obviously going to be very hot and uncomfortable, whether it's construction or manufacturing, or gyms where people go work out. Gyms opened up in the green phase. And we know when you're in there working out for a long period of time, people tend to take off the mask. And if they take off the mask, we might need more than 6 feet of distance, and we might need more than just a few people and not have 20 people or 30 people in a workout area. So these are the type of things, using good common sense, using good judgment, depending on if you're inside or outside, in an enclosed area, the spacing, all those things that we need to do. But we need to continue to listen to our health experts that have been giving us good advice. And if we follow that good advice, we'll continue to make progress on this very, very deadly virus that we're at war with. So let me now introduce Dr. Bogan to talk about some of the things she and her team have been working on and what they're looking at over the next few days.
Good afternoon, and thank you for joining us again today. Allegheny County has had more new cases of COVID-19 in the past 2 weeks than for the previous 2 months combined. The case counts have been in the triple digits now for the last 8 days, and now 3 times have exceeded 200 cases per day. As a result of this dramatic and rapid increase in cases, I issued strong public health measures to mitigate the risk of more community spread of the virus, including discontinuation of alcohol service and then the closure of all but takeout food from our restaurants. I am cognizant that we must balance the risks of infection with the risks that result from the mitigation strategies themselves. As I've said before, I will continue to apply the most current science and our data to inform my decision making. And I am truly sorry for those whose income and livelihood are impacted by these measures. I hope to release a new order by late tomorrow afternoon. I'm considering modifying the event limits and restrictions for outdoor food and beverage service at restaurants. I leave this open to change depending on our cases and the other metrics we consider in making these decisions. I and my team use a wide variety of metrics to determine the need for mitigation efforts. These metrics include the number of cases, which have dramatically increased. We consider the percent of those who were tested for the virus who tested positive. 2 weeks ago, our percent positive rate was in the 2 to 3% rate, and it has ranged recently from about 8 to 10%. We consider the hospitalization rate, which remains relatively low here, but we have seen a steady increase in hospitalizations. We want to see that our testing numbers increase as the number of cases increase. I have liked to use the Washington State metric on this one. The metric is that you have to have at least 50 tests for each positive in the prior week. And although we have increased our testing numbers, we are not currently meeting that metric in our community. We do have more than adequate hospital and ICU beds available at this time, but that is certainly a factor that we follow extremely closely. To inform the mitigation strategies that we implement, we carefully consider what we learn during our case investigations. During case investigations, those with COVID-19 have shared that they visited bars and restaurants during their infectious period. Last week, among 347 new cases who indicated during a call that they had attended a community event or mass gathering, 117 said they visited at least one bar and 50 said they visited at least one restaurant. We track the activities and locations of activities people report to us, and they run the gamut. None of the other reported activities compare in magnitude to the number of times cases have reported going to bars and restaurants. For example, last week, 36 new cases said they attended a private party. 17 visited a retail store. 13 said they watched or participated in some sort of sporting event, and 13 said they had gone to a gym. This virus is new. The information we collect during case investigations and contact tracing calls helps us learn more about it and its spread. It's really important that people answer the questions and the phone when we call from the health department. It helps really provide important information for us to make informed decisions. So thank you all to all of you who have answered our calls so far, and we hope you will continue to do so. I want to assure you all that we keep all the information shared with us completely confidential. As is clear from the long and varied list of activities provided by our cases, I want to remind everyone to please limit outings to those that are necessary. And no matter where you go, please wear your mask and wash your hands often. So thank you for your support in limiting the spread of the virus in our community. Stay healthy and be kind, and I'm happy to answer any questions.
There's a long list of questions today.
List of questions.
Let me start with the first one from KDKA. Parents are going to want to get their children tested so they can return to sports after traveling this summer, or even if they're visiting with grandparents. But we don't know of anywhere that kids can get tested without any symptoms other than the Washington Health System. What does the Allegheny County Health Department recommend for people who want to get their kids tested even if they don't have symptoms?
Yeah, so first of all, we did provide some travel guidance on our website, which I hope people are referring to. If children are symptomatic with symptoms, they should call their pediatrician, who can arrange for testing as necessary. Regarding children who do not have symptoms, we are definitely seeing some challenges in getting children tested in our community. We're also seeing a challenge in getting everyone tested right now. I think there's some waits in terms of test appointments. And so I'd like to ask our community to prioritize those who are trying to get back to work for testing. And if your child can stay home for 14 days, that would be my recommendation.
The next question is from the Tribune Review and is related. A number of high school coaches and administrators have mentioned that COVID-19 testing has become a major part of return to play plans for professional and college athletics, but it's not mentioned at all with high schools. Does the health department favor a team-wide testing plan for high school sports, and why or why not?
Yeah. So, professional sports have a very elaborate testing plan that they've arranged through private testing. And the difference between private and professional teams is you can sort of limit their exposures outside of that, where children who are part of high school teams, you'll test them at one point in time, but they're going to have lots of other exposures and they're not going to live in a bubble. So it would require repeated testing like they're doing at the professional sporting level. And I don't think we have the capacity at this time to do that in our country.
The next question is either for Dr. Bogan or the county executive from the New York Times. Do you think the state moved too quickly in reopening Allegheny County? And if so, what could the county have done differently in hindsight? How do you avoid a similar spike going forward?
I think in a lot of ways when things get moved from red to yellow to green, whatever it might be, it really is going to be based on the cooperation of all the activities that occur and the individuals who participate in those activities. You can have all the rules and regulations in place to do lots of things, but if people don't follow them in certain areas, then the system fails. And that's where we've seen the numbers go up. And I think when the state gave Allegheny County the ability to go into yellow and into green, it obviously opened up opportunities for people to go back to work, to have other things that they do with their lives. And the vast majority of those have been very positive. What Dr. Bogan and her team have done has been very strategic. They've looked at areas where the contact tracing and the investigations have shown the problem spots to be, and have isolated the activities there and the shutdowns there and the orders on there. To punish or to mitigate all those other industries, whether it be retail, whether it be construction, whether it be hair salons, all the other things that people also do every day, go to offices and real estate and car dealerships, etc. Those things have proven to be able to operate in a way in which the case level is low. They've acted in a way and put mitigating devices in, strategies in, masks, all those type of things have been positive. What we have seen in Allegheny County, no different than anywhere in the country, is that the bar scene and the bar situation makes it very, very difficult. So I guess you might look back and say, nationwide, that would have been something that should be looked at. And again, it's not just here in Allegheny County. I think an order just came out that Beaver County is going to be shutting down bars and restaurants. And I know some of my other county commissioners have been calling and they've seen an uptick, and they suspect it's in that very same area. So I know Philadelphia, New York, Texas, Florida, lots of them are making decisions along those same lines. So as we learn about the virus more and more, as Dr. Bogan talked about, and as we see activities that are much more difficult for people to operate in a very constructive manner, then certain activities need to be mitigated. So I think we're going to continue to learn, and we're going to continue to try to do the best we can, and I'm sure there will be mistakes along the way.
This next question is for Dr. Bogan. Are farmers markets currently allowed to operate, and if so, what rules apply?
The farmers markets are allowed to operate under the guidance from the Pennsylvania Department of Health.
This question is from the Post-Gazette. Given the need for so many more contact tracers, why not use volunteers? A retired teacher who contacted the health department was told that the health department was not currently in need of volunteers, though that may change, but said that she has still not heard back as to whether you could use some help.
Well, thank you for that question, and it gives me a great opportunity to talk about our Medical Reserve Corps. So I apologize for not getting back to the teacher who reached out to us. If you're listening, please, we would love for you to volunteer through our Medical Reserve Corps. We have been using the Medical Reserve Corps volunteers already in doing our contact tracing. We have 6 actively participating and have been for a while now, and we have trained another 60 Medical Reserve Corps volunteers today, and we are getting them up and running to help us participate in contact tracing, and we're always looking for more people. Again, if you go to our county website and you type in Medical Reserve Corps, you will come to the link. It's also, I'm trying to think, that's probably the easiest way to find it, or just in a regular internet search, you'll find it under Medical Reserve Corps. So thank you for offering to volunteer. We look forward to hearing from you again.
This next question is from KDKA. We talked to a group of 15 guys, their term, not mine, who went to a bar prior to the recent closures, and one of them tested positive for the virus. On the 25th of June, they all got tested, and today still less than half have received results back. What advice do you have for people that are still waiting for results? And is there any explanation the health department has received for a lag in results? They all went to different testing sites.
We have definitely heard about this problem both locally and nationally. For a while, our tests were returning very quickly, usually within 2 to 3 days, and I have heard about a lag in test results recently. And I think that's because the national laboratories are overwhelmed with the new surge in cases. It is something our country really needs to address, is the availability of more testing capacity in our laboratories. For those of you who were tested and are pending your results, we ask for you to please remain at home until your test results come back. And again, if you're a close contact, meaning the case who we called reported you as a close contact, and the county health department has reached out to you and asked you to remain at home, the quarantine period is 14 days from the date of last exposure to the known case. So please stay at home. Thank you. And if you do need to go out for anything, please, again, wear your mask and limit. We really like you to stay home and not go out at all. But if you do go out, please wear your mask. Be careful to wash your hands and limit all exposure to other people.
This next question is from the Tribune Review. Governor Wolf recently indicated that his mask order could potentially last until there is a vaccine. Is this something that county health officials agree with and support?
Yes, yes, yes. And I believe this is our new reality, and it will be for a long time to come.
This next question is from the Post-Gazette. You said last week, Dr. Bogan, that you were surprised by the surge and that you expected it to continue for a couple weeks at least. Has the surge's intensity, several days with more than 200 new cases and no waning, itself surprised you? And why do you think this has been so intense? Is it just a matter of thousands of young people crowding into bars and restaurants a few weeks back?
The initial surge surprised me. I thought we were going to have a quiet summer, but as I looked around the country, we were having surges in lots of places. So the initial surge surprised me, but once I saw that and saw the numbers of contacts that people had, the sustained rate of high cases has not. And again, there's often a delay in what we see. And the last time, if you look back at our data from March to April, it took us about a month to reach peak, and then another month to really come down completely. And I expect we'll see something very similar this time, but don't forget our numbers are higher this time than they were back in April.
This next question is from WPXI. If new cases remain high or rise, what other steps would the county consider taking to curb the spread?
The mitigation strategies will really depend on what we learn from those cases. And again, I'm trying to be very strategic. I really don't think it's great to shut down our entire society again. I don't think that's likely effective. I think people don't want to have that, and we would like to not be able to do that. So we will take it one step at a time. I'm always perusing what's happening around the world and what's been effective in other locations. Again, there's, everyone in the world is experiencing COVID-19. We are not the only place. And so I think it's really important to look to lessons learned from other locations, and that is part of my strategy, as well as looking at the case investigation outcomes.
This next question is from the Post-Gazette. When restaurants and bars in the county reopen, it would be helpful for the public to know which restaurants and bars are being cited in their inspection reports for not enforcing face masks, physical distancing, or other related protocols. Could those reports be flagged and the names of the businesses be posted on the County Health Department's webpage, similar to the way restaurants and bars that draw a consumer alert or closure order are flagged and posted?
I will bring that back to our team. I think that's a great idea. I don't know how easy it is to implement, but I appreciate that suggestion and we'll look into it.
You did answer this question, but I received it from several outlets. I'm going to ask it again. What would it take for on-site service or other accommodations at bars and restaurants and casinos to reopen and remain open when they do?
As I said in my remarks, we are reconsidering the order and we'll make our decisions slowly based on what we're seeing in our community. So I can't give exact specifics. Really, it's a big, broad look at all of the data we have to inform our decision making.
This question is from Public Source. Two of the nation's largest commercial labs, Quest Diagnostics and LabCorp, report demand for COVID tests has outpaced capacity, with the average turnaround time for reporting test results having more than doubled. You referenced that in a response to a prior question, but the question from Public Source is, how has this impacted the testing capacity in the county?
So we're seeing a couple things with testing. I understand that some of the test locations have run out of test kits. That's a challenge. And so getting the specimen collection is running into problems. And then once the specimen has been collected and it's mailed to a laboratory or shipped to a laboratory for processing, there is a delay in those. And I did address that. We're definitely seeing that locally. And I understand it is not just a local problem, but a national problem. And we need to, as a country, figure out a way to really increase capacity for test results, as other countries have done successfully.
This next question is from the Pittsburgh Business Times. Can you tell us whether there have been any health department or criminal citations for bars and restaurants after the most recent restrictions were imposed, and if so, why or why not?
I am not sure that we have imposed anything at this time, and we'll have to get back to you on that one.
That was a very fast answer. This next question is from WESA. Have there been any pediatric hospitalizations in Allegheny County since the start of the pandemic? And do you know how many pediatric hospitalizations there are currently?
I do not know the current number of pediatric hospitalizations. There have definitely been a few, I believe, in the past, but again, I don't have the details of that data in front of me.
This question is from the Post-Gazette. If you get 100 new cases, do you have any idea how long that would generally take to trace them all?
Our case investigators can handle about 8 cases a day. And so we have worked very hard to increase our number of case investigators in response to the number of cases we have. We try to call cases as soon as we find out about them within a day, has been our general approach. So again, we try to reach all of our cases within about a day of us getting the result. Again, sometimes people, I will put a caveat that people sometimes hear about the results before we do, because perhaps the doctor that ordered it called them with the results, but it hasn't been put into our state database. So if there's ever a delay, like you get your result on a Friday and you don't hear from us till Sunday or Monday, it's because it hasn't been put into our state database, and we don't initiate a case investigation until it's in our state database.
This next question is from WESA. It seems as though the median age reported with each new day's results has increased over time. Does that suggest that the patient population is getting older, or that this new surge in cases is spreading to other people?
Again, the rise has been, we went from age 26 to I think 30 or 31. Some of it was reflective of some cases of long-term care and some elderly, which we've had. And so it also, I think it's really just not entirely sure. But again, I think if you look at most of our cases still remain in our 19 to 24-year-olds. Is about 25% of the cases in the last couple of days. and 50% are between ages 25 and 49. So still, almost 75% of our cases are among 19 to 49-year-olds, so a very narrow age range.
This next question is for the county executive from the Post-Gazette. Do you think it is politically possible to convince people that going back into either the yellow or even red phase because of a surge in cases is justifiable? And would people accept that, or have you contemplated that happening?
Well, again, I think Dr. Bogan addressed the fact that she wants to be strategic, and as her and her team look at where the cases are occurring, the case investigators and the contact tracers, they're being strategic in going after areas that have seen some of these cases. It's hard to say. This has been. Did we ever think we could shut things down back in mid-March to the level that we did? It was almost unreal to see certain streets that didn't have traffic in the morning rush hour for a number of weeks. And sometimes we have to accept what the science and what health metrics tell us to do, and we want to protect our families, we want to protect our communities, we want to work, we want to make money, we want to earn a living, we want to do the activities that we've all had to do, school, weddings, and all those type of things, funerals, all the different things that are part of life that have been adjusted. Going to church, going to the synagogue, going to the mosque, all the things that we do, and we're a social people. We love to be able to go out and have our block parties and all the things that bring people together, and those things have obviously been interrupted. So I don't know that we could go back to a yellow or a red. I think you'll see exactly what Dr. Bogan and you're seeing around the country is people are looking at certain areas that have been very difficult, and if some of them have opened up and have proven to be problematic, then they've been shut down. But even I think within those areas, I think there will be different strategies, and we're, I guess, talking about the restaurant association, restaurant industry right now. Not all restaurants are the same. Some of them have outdoor seating, some of them have more space, some of them have different ways in which they can mitigate it, just based on the way they operate. So it's difficult to have a one-size-fits-all on the economy. It's even difficult to have a one-size-fits-all even within a certain industry. So I think their team is going to continue to work. They're going to continue to do all the good things that they've been doing, looking at data, looking at operations, and making the best decisions for the community.
This next question is actually for both of you, or either of you, whichever you'd prefer. This is from the Post-Gazette. The State Department of Health today said that we do not think that anytime you have a regional hub, there's going to be some spread that goes out from the hub. Excuse me, it says we do think that anytime you have a regional hub, there is going to be some spread that goes out from the hub. And in this case, it's to the counties in the Southwest outside of Pittsburgh. Have you talked with anyone from the state about the regional surge in cases in surrounding counties? And do you or they believe the surge in surrounding counties is related to the surge in Allegheny County?
I'm going to ask Dr. Bogan to answer the part of that, but let me just say, as a region, we aren't isolated just by county lines. Our workers, many of them work in downtown Pittsburgh. Many workers in downtown Pittsburgh work or live in the city of Pittsburgh, work in rural communities. We go back and forth, obviously, for education, for medicine, for other activities, sports, which hasn't been as open as much. But we don't just live in isolation. Our families, we have family members that live in various counties. People, I'm sure, got together over the holiday weekend and traveled across county lines to visit family members. So there's no way in which something that happens in Allegheny County is only going to affect Allegheny County residents. Vice versa, anything that happens in Westmoreland, Butler, Beaver, Fayette, etc., is only going to affect those areas. So we would certainly anticipate that as things happen in one county, they're going to spread and be affected by the adjacent counties, and that's probably just a natural way. But it's the way we live. We're not going to change the way we work as a region, the way we work together, economically, socially, every other way. Dr. Bogan, if you want to address maybe the health aspect of that.
I wish I had more to say, except that viruses don't know the boundary between our counties. So yes, as people interact across county borders, we will get spread. And just as we saw travel from other states and other regions, as you come in contact with one another, the virus gets spread.
This next question is from WTAE. Do you expect Allegheny County's death count from COVID-19 to go up in the weeks ahead? And is there any reason that that is more or less likely to happen now?
Well, that is certainly my concern, and one of the reasons that we put some of the mitigation effects into effect, mitigation strategies. But boy, I would love to be proven wrong, because I would love to see no more death from COVID-19 in our community.
This next question is from Public Source. The National Association of County and City Health Officials recommends 15 professionals, including epidemiologists, disease investigation specialists, public health nurses, community health workers, and contact tracers per 100,000 population to effectively address COVID. Can you tell us how many of these professionals that the health department currently has?
So I'm going to answer that a little differently, because I think using that big number is hard to imagine. But as I said, we estimate that each case investigator, that's the person who calls the positive case, can reach about 8 people in a day, with some variability, depending on how complicated the case is and the number of contacts. Our case investigators can reach about 15 people a day. So you need the number of people that based on the number of cases and contacts you have. We also need people to look at our data. So we have people who prepare our website. We have epidemiologists that are combing through our data and gathering important information so we can make good decisions. We have people who are working in our communications. So you need a team of people, and that number varies based on the number of cases we have. So that absolute number that NACCHO has provided is one metric. I prefer to use sort of the metric, are we getting to reach all of our cases within 24 hours, and do we have enough people to reach all of our contacts, and do we have the flexibility to expand to reach people as our cases and contacts change over time.
This next question is from the Pittsburgh Business Times. Can you gauge the success of the restrictions that you've put in place so far and how long they may last? I know you answered the second part of that question, but the first part of that question.
I think it's too soon to see the real effects. Again, there's a big delay. We're getting delay in testing. We're getting delay in results. I'm thrilled that we didn't keep doubling our case counts. We were seeing a doubling almost every day. We got to about 200. We've seen some variability between the 100s to 200s. Gosh, I hope we don't go any higher, but again, I don't think that we can say with certainty that what we've done right now has had a huge impact. In another week or two, we should be able to see that impact. It took a month the last time, really, to see the effect. We reached peak about a month after we started with our cases, and we took another month to decline.
This next question is from the Post-Gazette. If your tracers are finding that a given bar or restaurant has been visited by a number of people now testing positive, it's easy to understand why those locations might be shut down. But if your tracers find no cases coming from other establishments, shouldn't there be a mechanism for that place to reopen to reward those who evidently did everything right?
So again, I am working on modifications to the order, and I hope to have those out tomorrow.
This question is also from the Post-Gazette. The week before indoor dining was shut down in Allegheny County, complaints from the public about restaurants and bars not enforcing face masks or other protocols surged. According to County Health Department data, there were 419 virus-related complaints the week of June 29th. That compares to 116 complaints received during the first 20 days of the green phase. What do you make of that?
I think it may be related to our request for people to report on case when they're seeing things not the way they're supposed to be. And it also may relate to people's concerns. So as we reported more cases, my guess is the concern among the public also increased, and therefore people were more likely to report concerns. So those would be my best guesses as to why we saw that increase in complaints. And again, I think it is helpful for us at the County Health Department to understand what people are seeing out in the community. And we appreciate those reports because it helps, again, inform our decision making. So thank you.
I have two last questions, both from WTAE. Pennsylvania is 5th in the country for the positivity rate from testing, but 46th in testing per capita. How does that positivity rate and testing rate in the county compare to the state as a whole? And can you tell us a little bit about what you're doing to increase testing and any barriers that you might be facing?
So there's multiple parts to that question. So I did look at the state health department website before the briefing, and it looks like that the state is, I believe the positivity rate at the state in the last week was about 4.5%. And I think according to the state website, we're at about 7.5%. Again, so we're higher than the rest of the state currently. And in terms of the second part was, Amy, I'm forgetting the second
What
part.
are you doing to
increase testing.
and any barriers?
So, testing, we're working with our healthcare organizations to try to increase capacity through those sites, working on some initiatives within the health department itself, and working with the Pennsylvania Department of Health to try to address that as well. I don't have anything specific at this time, but it's certainly a concern, and we are aware of it and trying to come up with some strategies to address it. Again, I struggle because some of this is a national problem and not necessarily a local problem, but we need local solutions, and that's what we're working to try to address.
Perhaps I should have counted that question as 3, but I counted it only as 1, so I have one last one from WTAE. Can you tell us how you're counting positive tests? Does the number reflect simply positive tests, or does it include presumptive positives and positive antibody tests?
So in the county, we are counting positives and probable cases based on our contact tracing as well. We do, antibody tests is a little more complicated. You have to have a positive antibody test and symptoms within 60 days before that antibody test, and that's the state requirement for how to call that a case. I spoke to Dr. Brink before the briefing, who is our head epidemiologist, about how we're handling that. And we have not been able to call all the positive antibody tests because those people are past isolation requirements at this point, so they have not been our priority. So we have called some of them and deemed them yes or no a case, but others we haven't yet gotten to. So I guess it's a little bit of a nuanced answer, probably perhaps more than you would like. So the answer is yes, we count cases, we count probables, and we are counting some antibody tests, but eventually we will count all of those that we reach and can verify that they had symptoms within 60 days of that test.
And just for a follow-up clarification, we understand that the positives and the probables are separated in the report each day, and that the
Probables include the antibody tests and the probables both. Is that correct?
Probably that's best answered offline because I'm a little bit confused by the question, and I want to check with Dr. Brink on the details. So I want to make sure I give you the accurate information.
That is the last question. If you have any closing remarks.
Well, first of all, I know we say this, I've said it before, but I want to say it again, we got to thank so many people, our first line responders, first responders, people that have been out battling this pandemic for many, many months. And our health department, led by Dr. Bogan and this team, have been working tirelessly, and the decisions that they make and the orders that they make are not done lightly. There's an awful lot of work that goes into them, an awful lot of thought, an awful lot of care, knowing that there's always going to be ramifications that occur on any type of an order, numbers that how many people can congregate, or what business would be affected. They're not done lightly. So they really do are serving the public in so many ways. And I know anytime a decision is made, there's going to be people that are going to disagree and want to blame certain folks, whether it's the state, whether it's the feds, whether it's us locally. But I can tell you that these decisions, again, are not made lightly, and they're done really with the public interest in mind. And we'll continue to do that throughout this pandemic. Dr. Bogan alluded to one other thing I think that has taken us all a little bit by surprise. We were told in April and even early May that when the weather warmed up, the sun would help us out, and the warm weather would help with the virus, and we would see cases become lower and we'd have to really be worried about the fall, the next wave, which would occur in the fall. And we were hearing that from the CDC, we were hearing that from state, it just all the medical experts were saying that, and that was obviously has not been the case. Hasn't been the case locally, and it certainly hasn't been the case nationally, as we're setting records every day in many states of new cases that are occurring. So we've got to adjust, and that's what we're trying to do. That's what Dr. Bogan and her team are going to continue to do. Using the analogy, I'll use a sports analogy of hockey. We have a great hockey team. It's not about where the puck is right now. It's where the puck is going to be and where they anticipate that puck will be a week from now, a month from now, two weeks from now, 2 days from now. And as these numbers come in, and these numbers will change, there's going to be continued modification. There's going to be continued change. And I know that's hard for a lot of us. It's hard for me. It's hard for businesses. It's not for families. We want to know, we want to be able to predict where we're going to be a week from now. We want to make plans for our life. We want to make plans for our families. We want to make plans for our work. And some of the times those plans are going to be changed because of the numbers and the way that the science will continue to lead us. So let's continue to work together. Let's continue to help each other. Let's continue to support each other. Let's continue to wear our masks, put our masks on, socially distant, all the things that we all know we've been teaching, and not just get lax. I know many of us are impatient. I certainly am. We want this to end, but guess what? The virus is going to decide. And until we have a vaccine or a cure, we're going to have to continue to work and continue to cooperate and continue to do all the things we know we can do to keep ourselves safe, keep our families safe, keep our community safe. So God bless.